So I'm Rachel Watson and I'm a GP and I also run a bakery school, and my plan is to open the physician's kitchen. I've been a doctor really for about the last 27, 28 years and I very much learnt the biomedical model of medical care. And over about the last 10 years, as I've become more experienced, I've realised that it really doesn't do a lot of patients any favours. And in fact, there's a whole cohort of patients where it simply doesn't explain what's going on at all. So people with irritable bowel syndrome or migraine headaches or strange pins and needles or strange numbness or loss of power, and you talk to them about it and the history that they're telling you in your examination, it just doesn't really tend to sort of come together. There's no pattern. You can't come up with a diagnosis, and you might do some investigations and some blood tests. You might refer them to an ologist to get a specialist opinion, and everything comes up as negative. So you're left with this patient who is really suffering because these symptoms are real, and yet nobody can give them a diagnosis and nobody knows really what's going on. And so I began over the last couple of years reading about psychophysiological disorders, and the most common one is pain. And I began to realise that the unconscious brain is what's really important here. And so I wanted to know more about the unconscious brain, and I wanted to know how to access the unconscious brain. And then I wanted to learn some new skills and to gain some new tools to help patients or clients understand more about their own unconscious brain and help them change their behaviours and change their lives. So I think the things that I've taken on mainly over the last 8 days and by listening to the audios are really the power of language. And I think sometimes we're a little bit slapdash as doctors with our language, and we tend to use a lot of labels. And a lot of patients actually want a label, but I'm beginning to realise how unhelpful that is. And so I think being more careful with the words that I use with patients, and I really like the idea of using hypnotic language, because I think when there are messages that you're trying to put over which are really difficult for patients to understand, being able to use some hypnotic language to sort of bypass their sceptical conscious brain and get those messages a little bit deeper down would just be fantastically helpful. On a personal level, there are so many things that have changed. So just thinking about relationships with friends, with family, with people that I meet, with talking about my plans and feeling more confident about the plans. And I'm absolutely now feel ready to open the physician's kitchen and really start doing it and start coaching. So Michaela and Bridget have completely blown my brain with so many of the things that they've said. I think if you'd asked me sort of 3 or 4 years ago about some of this stuff, I would have just said, what are you talking about? But it's explained in such a clear way that I've really been able to understand what they've been talking about. And I think the other thing is that because it's so nice and relaxed and it's so enjoyable, it is really easy to take this stuff on board. I heard somebody say recently that often when you go to a presentation or you're learning something new, that you look for the things that the presenter is saying that you agree with, and you sit there and you nod. But what you should actually be doing is looking for the things that perhaps you don't really agree with and going, I wonder if that might actually be true. And when you do that in this course, yeah, that's the bit that blows your mind.